from the station that's on your side. This is Channel 7 News Daybreak.
Welcome back into Channel 7 Daybreak. Today's Wellness Wednesday, and Dr. John Allen Cockerell from Baptist Health joins us this morning, and we're talking about a new study on e-cigarettes. Dr. Cockerell, thanks for taking time out of your day to join us. What can you tell us about this new study, and why is this something you wanted to bring to our attention today?
Sure. So, interesting study. E-cigarettes have been around for a long time. People have various views on them. I thought during this pandemic, it's been interesting to see the rise of certain things that people choose to go to. We talked about alcohol, last time on here for anxiety and stress relief. Sometimes, nicotine can be that release for people too. So I wanted to focus on cigarettes and e-cigarettes specifically. There's a new study out from the NJPM, the Journal of Preventative Medicine, on e-cigarettes, their use, the kind of the stigma around them, what people are saying about them, and then some of the health outcomes as well. So for all those reasons, wanted to touch on it because it is something real in society that needs to be looked at, especially with stress rising and continuing on during the pandemic.
What are some of the unforeseen consequences of e-cigarette use?
Sure. So one interesting thing with this NJPM study, which looked at over 5,000 participants, was a fairly high rate of people realizing that things maybe that were once reported with e-cigarettes are not entirely accurate. So there's more, understanding of what they are, and certainly not trying to pick on anybody in particular with this, but they do contain nicotine, right? So as opposed to other cigarettes, other combustible forms, they are still nicotine containing. What we know on the body that does, to answer your question, we know that affects, breathing and things of that nature, infection risk, but also things like fatigue, mental health, right, which I talk about a lot on here as well. So things that nicotine do in the body to the neural circuits, things that change over time, those are a couple of the examples that affect not just the breathing, but other things as well.
Whenever you talk about nicotine and how that's the addictive nature of cigarettes, and it can also be found in e-cigarettes. If someone was looking to stop e-cigarette use, originally when e-cigarettes came out, remember, they were the bridge to possibly quit if someone wanted to. And now it does seem like it's not been that bridge. It's just been another outlet for nicotine use in some cases. So if someone wanted to quit e-cigarette use and they've been using them for a while, what resources and programs are available for that?
Sure. Well, the cop-out answer is talk to your doctor, but that really is true, because what we're learning as doctors too, we're learning alongside everyone else here, right? That some of these new products, these e-cigarettes, and not as new now, surely, but there are specific interventions we can do. There's certain medications that we can do, certain non-medicinal options to help you, kick the habit. When they first came out, you're right. They were kind of options that were alternatives. And by no means, again, am I trying to, sell anyone out for using these substances or using nicotine in general. We just want to help, and there's ways that if you got trapped in this thinking maybe something different than what it actually is, there's ways to help. And it starts with a talk to your doctor. But again, medicinal and non-medicinal ways to help out. Just wanting to put the PSA out there, so to speak, about e-cigarettes and their use. Interesting study. Again, if you want more information, the NJPM has a new release on this. Times are changing. People's perceptions are changing as well, and we want to help as that change happens. This is something we can help with.
All right, Dr. John Allen Cockerell from Baptist Health. Thanks for joining us, Dr. Cockerell. We'll talk with you next time. If you'd like to contact Baptist Health, the information is on your screen.